All right, we're going to talk more on this then. Let's discuss this further. We're joined via Zoom by Gauteng Shadow MEC for Health, Jack Bloom. Very good afternoon to you, sir. We just want to make it clear to our viewers, though, that we did try to reach out to the Department of Health, the Gauteng Health Department, and they said they will later issue a statement regarding the matter. But let's bring you in then, Jack Bloom. A very good afternoon to you. Thanks for availing yourself here to SABC News.
Good afternoon to you.
Let's talk about how bad the situation is at Chris Hani Baragwanath Hospital. We, of course, heard the reports that the hospital had run out of food, and the latest being, well, the department saying that this has now been resolved. But you've certainly got your ear to the ground there. What are you hearing at this time? Maybe we can also talk about the picket that's currently taking place.
Well, the situation was so serious that doctors and nurses were bringing extra lunch and buying food from hawkers outside the hospital in order to feed the patients. They've been without bread for more than 2 weeks. Can you imagine? This is our largest hospital with a budget of 3 billion rand, and they ran out of bread. They weren't even able to buy bread for patients, and they were short of other food stuff as well, and charity organizations have now been involved. So I think it's just shocking mismanagement. But if you go to the hospital, you'll also see that there's waste piling up all around the hospital because the waste company hasn't been paid, and so they're refusing to remove the waste. The financial year ends at the end of March, and typically towards the end of the financial year, the department runs out of money and they don't pay suppliers. And if suppliers aren't paid, they don't supply what they're meant to supply. So you run out of food, the waste builds up. It's actually not just Chris Hani Baragwanath Hospital, but all the hospitals are affected one way or another. And of course, earlier we had the situation where 10 intern doctors weren't paid until earlier this week. It's just a department that's in a shambles. They simply can't manage their money. And there's probably corruption involved with contracts as well. And, of course, the people who suffer the end of the top patients. Yeah. Can you just imagine being in a hospital and they don't even provide you with bread?
So, of course, you mentioned the budget. And by the budget that you've mentioned, it seems to me that money shouldn't be an issue. And indeed, 30 million Cuban doctors were paid. 30 million was spent on Cuban doctors last year. So it doesn't seem as though there's a money crisis. So when you do probe the matter, which I'm assuming you do, what is it what they say? What does the Gauteng Health Department then have to say? Because it surely can't be about money. A basic of patients not being fed is a huge crisis. So what is their excuse? You say it probably is corruption. That's not what they're saying. But when they engage with you, what are the excuses that they're coming out with about why they're running out of money?
Well, as I said, it's towards the end of the financial year and there's a cash flow crisis. And they've also got what they call accruals. These are past debts that they haven't paid off and they're trying to pay it off now. For many years, this department has been plagued by mismanagement, and there's been a massive waste of money, quite frankly. The department has a huge budget, 59 billion rand. That's really a lot of money. It's just mostly spent, in large measure. They just waste a huge amount of money. At Chris Hani Baragwanath Hospital, for instance, they built 500 new wards for COVID patients, and these new wards are all empty. And the picket today at Chris Hani Baragwanath Hospital is because there's a whole lot of posts that were created for the COVID-19 epidemic. And now at least half of those people who were recruited are not going to have jobs in April because there isn't enough money to keep them on. Now, the reality is that COVID or no COVID, our hospitals are desperately understaffed. And they do need to be properly staffed with local doctors and nurses. We don't need to go to Cuba to spend a huge amount of money on Cuban doctors. So I think there's justifiable anger there and justifiable concern because at the end of the day, people are suffering there. Doctors work under inhuman conditions in many cases. There's a linen shortage at the hospital. That's what doctors will tell you, and operations get cancelled. Why are there basic management duties not being done? And I think that there's a broader crisis here, and it's a failure of Gauteng Premier David Makura, who said for 8 years now that he's going to fix the Gauteng Health Department, and it still hasn't happened. So look, the solution really is to put the best people for the job, spend money correctly, cut out all the corruption and wastage, and then I think we could do far, far more for the health of our residents in Gauteng.
Yeah, of course, we've been also hearing about refurbishments and promises of refurbishments. In fact, the Charlotte Maxeke Johannesburg Academic Hospital, which is really in need of repairs, has still not been repaired after the devastating fire in April, I believe, last year. We now understand that the Gauteng Health MEC, Nomathemba Mokgeti, has since now, blamed vandalism for the delay in reopening the accident and emergency unit at the hospital. How much do you know about this, and just how true are these claims from what you've seen or what you've asked?
Well, it appears the vandalism involved massive theft of copper piping. Now, I don't know why we have theft at that hospital when we spend 40 million rand a year. Can you believe it? 40 million rand a year in security, and we get vandalism and theft. And this is given as the cause of the delay in reopening the accident emergency at Charlotte Maxeke Hospital. It was supposed to open next week. Now we're told that it may open by the end of the month. I think you need to know the consequences of this, because it means hundreds of patients go to Helen Joseph Hospital and other hospitals. They can't cope. They don't have extra staff. They don't have the space. People sit in corridors until they manage to get admitted to a ward, and that could take days. So I think that we really have a really incompetent department. They can't even fix up Charlotte Maxeke Hospital. There's already an SIU investigation, so we know that there's corruption. So they've just handed it over to the National Health Department, and hopefully they can do a better job. But I really think once and for all, we need to appoint the right people. Do you know that in the Gauteng Health Department there's an acting chief financial officer and an acting head of department, and we still haven't filled those posts with permanent people. Now, until we put the right people in who do the right things, we're still going to have crises like we have at Chris Hani Baragwanath and other hospitals. It's just very tragic. I really must say that.
All right, thanks very much for giving us your time. Jack Bloom, DA Shadow MEC for Health in Gauteng.